Welcome, everybody, to Live with Dr. McDougall, our weekly sessions with Dr. McDougall. These are not pre-recorded, so you're watching this as it's happening. I am Gustavo Tolosa, the webinar host, and I'm in Dallas, and Dr. McDougall is out of town on a little vacation, snowed in somewhere in Northern California, and so he's so kind to join us today. And I just want to mention one thing today. I hope that all of you realize what a really special gift we have with Dr. McDougall every week, so that you can actually see him live and ask him questions. I know that there are many doctors out there in the plant-based world, and they're very nice, and I know many of them, but I only know one of them who does a free webinar every week, and it's Dr. McDougall, and he's such a caring, generous person. I personally want to thank you, Dr. McDougall, for taking this time. You really don't have to do it, but you care enough that you take time every week to be with us. And thank you, and welcome to today's webinar.
Well, what a nice thing to say. I've been trying to share this message for almost 38 years, and thank goodness technology's gotten to the point where we can reach, well, maybe we have 1,000 people listening right now, and probably by the time the webinar is played for a couple weeks, because it is on the website, and you can get it again, rewatch it, and share it with friends. We probably get 7,000 to 8,000 people that get a chance to hear what I believe so much, and the things I'd like to share with you to help. So it's an opportunity for me. The whole thing, believe it or not, is helping other people. I mean, that's the great gift in life, is to have some way you can help somebody else. It's not money. Right. It's just to see other people's lives get better. And arthritis, which is our topic today, is one of the more fun things to treat, because people with arthritis are so helpless and hopeless, and they're put on these terribly expensive medications that increase the risk of cancer and infection. They have to take shots and all kinds of things. So I particularly like to talk about arthritis. And by the way, if there's any dissenting opinions out there, any doctors or anybody who thinks that what I'm saying is untrue, I'm happy to challenge you, or happy to have you challenge me. And if you go to my May 2014 newsletter, if you want to see some of the science and some of the patients who I've had a chance to treat with very, very serious arthritis, like psoriatic arthritis and rheumatoid arthritis. And I'll just tell you right now that these inflammatory arthritises, like psoriatic, non-specific arthritis, rheumatoid arthritis, lupus, these diseases are very, very easy to treat. Lupus, it takes a little longer for these people to get better, but most rheumatoid arthritis patients, they start to get better in about 4 to 7 days. And I would say essentially pretty close to 100% are curable by dietary change. Now, I want to mention that there's a lot of damage that's been done through years of inflammation. This is not going to be reversed. You know, the crooked fingers and the swellings and some of the joints that are fused, they're not going to be turned around by a dietary change. You can just stop the inflammation. So anybody who doesn't think that's true, any physician or scientist out there that thinks that isn't true, show me the data. You know, I'll show you my data. I'll show you 30 papers that show that you can dramatically improve or actually cure, published in the Lancet, for example, rheumatoid arthritis. You show me the data where you can't. And I'm talking about a treatment that costs nothing, does no harm, gives you a good bowel movement, cuts your food bill by about 40%. And the treatments that you guys are using, they cost, $25,000 just for the drug for the year, at least. And they kill people. I mean, what are we weighing, tanks and bombers against apple juice? It's just unbelievable. So contest all you want, because I'm here to tell you what I think and to show you the support. Now, as we get going here, I really want to save most time for questions. There are all kinds of arthritises. Arthritis just means that the joint is inflamed. It could be from an infection. It could be from trauma. It could be from wear and tear, which we call osteoarthritis. It could be from an autoimmune disease, which is an inflammatory arthritis, which is what I really like to focus on, because these people are so sick and hopeless, and their whole lives are being ruined. And they're so easy to treat with a dietary change at no cost, no risk. You don't even have to stop your medications. You just change your diet, and when you get better, then you stop your medications. You know, you got nothing to lose. The same diet that prevents heart disease, and as I say, it gives you a good bowel movement. So just to mention the infectious arthritises and the traumatic arthritises, you know, these may need some doctor help. And certainly, if you cure the infection, or you stop banging the joint, you know, traumatic arthritis, they're going to get better. The osteoarthritis, wear and tear arthritis, that's a dietary disease also. But it's not like the inflammatory arthritis. This is a dietary disease in the sense, osteoarthritis, you know, that's what I'm talking about. Degenerative arthritis. This is a dietary disease in the sense that people are raised on an unhealthy diet their whole life, and their joints and cartilages just become weak, and they don't resist the minor trauma of even sewing, you know, sewing or typing. They can't resist that minor trauma because the joints and cartilages are so poorly nourished by eating the Western diet. Just think that, you know, people in Africa and Asia carrying heavy baskets on their heads and working in the fields all day long. Osteoarthritis 35 years ago was essentially unknown in these people. And I have the research papers to show you that. And here in the United States, as I say, people doing things as non-traumatic as playing the piano or sewing, their joints just fall apart, and that's because of the food. This degenerative arthritis is difficult to show improvement in, but you can, particularly if it's in the lower extremities and you lose weight. And I would say about half the people I treat with degenerative arthritis would say that they're better. But it's not like inflammatory arthritis, like lupus and rheumatoid and psoriatic. I mean, people, it's like night and day. And it begins very quickly, the healing does, but it takes time. Sometimes it takes, you know, sometimes it takes 4 months. And in some patients, and you'll read about them in my May 2014 newsletter, some patients have worked a long time to get the most improvement. But it keeps getting better and better. But usually by about 4 months, you're a whole different person. So I think that's enough as an introduction. The diet, of course, is the diet I teach in general. It's you can call it the McDougall diet. I like to call it the McDougall diet because it really defines it as a starch-based diet with fruits and vegetables, no oils. This is very important. If you follow a vegan diet, you use vegetable oil, you'll get sick and stay sick with inflammatory arthritis, and no animal foods. And all that information is free on my website. You can go read it, and you know, you can talk to your doctor about it. As you stop your medication, you want to inform your doctor that this is what you want to do, and hopefully you'll get the support. But I mean, when you get better, why would you stay on these dangerous drugs? Makes no sense at all. So anyway, you got some questions I'd like to start out with?
Very good. Dr. McDougall, can you tell us a little bit about where people can find some of your the studies or the newsletters or the videos on your website?
Well, you just go to the website and you look under education and you find videos. And there's a video about treating inflammatory arthritis. And then there's that May 2014 newsletter. Or just go to the search engine and type in arthritis and you'll see, you know, lots of articles that I've written. As far as getting the scientific studies, I have those on my website, but they're available only to people who've signed up for the CME course or the CME course. That's a doctor-approved credit that doctors have to take. It's category 1, so it's the highest credit you can get. So if you take the CME course, you have access to hundreds of articles, including, you know, maybe 100 articles on arthritis, maybe not. Anyway, there are plenty of articles. All the articles I'm talking to you about are on that. And then the other place you can find, actually, if you look under Hot Topics, Arthritis, there's a article called Diet, the Only Hope for Arthritis. And the references for many of the basic articles are there. You have to go look them up on the internet. And then also there's the total, the Starch Solution Certification course. And people who take that course, they also have access to all of these basic articles, but they're not hard to find. well, they are hard to find because they were done
Right.
before the drug industry owned the journals and owned the scientists, which happened about 1980. And but many of them are still published after 1980. But plain and simple, folks, the drug companies bought the journals and they bought the doctors that do the studies. And that's why you're not seeing the information anymore, because it's just business.
Right. It's just a business, like you say.
But
So,
lots of research out there.
right.
And there's a randomized control trial published in the Lancet about using it was published in 1991. So that's pretty current. And it was done, a randomized control trial using a vegan diet, and 100% of the people got better in a week. It was a fasting and vegan program. Those who stayed on the diet continued to get better. Those who got off the diet got bad. I mean, you know, what better could you get than the Lancet? And you can always go to Google or PubMed.gov, and you can look up the articles yourself. Look up diet and arthritis. You can find a lot of that. The research is there, and like I say, you're not going to come to me and say, I left out anything, or these studies show that it doesn't work, because you won't find it. You know, I know the research on this, but what's more important than the research is that it does work. It costs you nothing, and there's absolutely no reason for you not to try it.
Right. Right. Well, can you explain? Just now you said that no oil. Of course, people keep asking, what about olive oil? It's supposed to be healthy. Can you explain how oils affect or how they produce inflammation?
Well, you know, there are different kinds of oils, and they have different effects. Some are pro-inflammatory. Those would be particularly the saturated fats. Then there are also the polyunsaturated fats, which are anti-inflammatory. And you can find studies, for example, I can think of one right now where you use primrose oil. And you give it to patients with rheumatoid arthritis, and their pain decreases by 30%, because these oils suppress the immune system. So it suppresses the pain, but they also suppress the immune system to the point where people have a higher rate of infection, and a cancer grows much, much faster when you suppress the immune system. And so it's a double-blade sword. It's like using a drug to treat your arthritis when you use these polyunsaturated fats. As to why the arthritis returns when people go, for example, there's a study that I have in this collection I was talking to you about, where people with rheumatoid arthritis went on a fast, a water fast. And in a week, they all got better. And then what they did is they returned them to a vegan diet with about 50%, 40 to 50% of the diet consisting of oils. And the arthritis came back, and all the patients, except for the ones with psoriatic arthritis, and I don't know why that was. If I didn't mention psoriatic arthritis and psoriasis, respond extremely well to a dietary change. You will not be disappointed. But that's the most science I could go into. There are probably people who have deeper knowledge as to mechanisms, but that's as deep as I can tell you in mechanisms. But the important thing is the results are evident really quickly.
Well, some people are asking about the elimination diet.
Okay, the elimination diet.
Talk a little bit about that.
Well, I start people out with the basic McDougall diet, except for wheat, because that's the most common gluten-containing food that people eat. And it's just kind of my guess that it would be better to start out with wheat, with the possibility you may have a few people with a gluten problem, which creates a leaky gut. And the other thing I ask them not to do is eat soy foods when they start out, because it's so easy for people to get into soy as a vegan healing diet. And so they buy soy burgers and soy hot dogs and soy cheeses and so on. So I say, and for those reasons, nothing specific, more specific in terms of arthritis, but for those reasons, the possibility that a few people, maybe 1 in 100, would have a gluten sensitivity. So I just say, forget the wheat when you start out. And people just don't do well on the soy, and they often get into these fake soy foods. So that's where I start. The next step to take is I put people on a gluten-free diet, which is, most people don't have to go there. they just get it solved with the basic diet. Starches, 90% of the diet is starch, like rice, and corn, and potatoes, and sweet potatoes. But a few people, very few, and it was really very few, have a gluten sensitivity problem, which leads to a disease called celiac disease, which increases the permeability of the gut, and they get a leaky gut syndrome. And so food proteins get into the body, which is how this whole arthritis thing happens, is food protein, particularly cow protein, gets into the body, and the body makes antibodies against the cow protein, which attack the joints. And so you don't want the gut open and permeable. So, but a few people have to go off wheat, barley, and rye. And then the next step, as not quite a last-ditch effort, there's one more last-ditch effort, but the next step is the elimination diet, which is the diet that has been used for, maybe 100 years to help people with arthritis and other allergy diseases, allergy-related autoimmune diseases. And that's a diet of rice and sweet potatoes. You can use sweet potatoes. And it's green and yellow vegetables and non-citrus fruits. Now, I can't give you a great justification as to why I put the diet together that way, except for that's what history says, is that these are the least likely foods for people to have a reaction against. And that evidence comes from work that was done in the 30s, 40s, and 50s. Nobody uses elimination diet, or not very many people now. So I put together the elimination diet back in the early 80s based upon what other people had done. And, brown rice and or sweet potatoes, green and yellow vegetables, and non-citrus fruits, all cooked. And the reason you cook it is you denature the protein by cooking. So you're just trying to get well. And then after you get well, you see the improvement, you can start adding things back. And there are a few people, not many, but a few people I've run into that the elimination diet, they had to go to solve their problem. And that's next to the last tool. On occasion, and it only happens to me once every, maybe 1, 2, 3 years, I get somebody who just doesn't do well for whatever reason. The diet isn't enough, or they're really not able to do the diet. That's common too, as strict as it should be. And what I do is I send them to a fasting center. And the one I use is a couple blocks from my clinic in Santa Rosa, California. It's called True North. And it's a water fast center. And they will take you off everything except water. I have to tell you, the few people I've sent over there who I couldn't solve with the tools I had, and they were solved by the True Fast, the water fast, there aren't very many. But I'm in a desperate situation where I've done everything I know to help. And the water fasting is the ultimate in elimination. And many, many studies have been done using fasting in curing arthritis. The problem is water fasting is only temporary. Then you've got to go back to eating. And fortunately at True North, they do teach you to eat a diet very similar to what I recommend. And so when you go back to eating, you're basically on the diet that I wanted you on in the first place. But at least it's a test as to whether or not you can solve the problems with food. If you take all the food away and you get well, that's a big clue that food's causing the problem. So a water fast would be the very last step. Unfortunately, very few people have to do that.
Right. What about cooked fruits? Someone is asking, do you actually need to cook fruits?
That's the elimination diet. And the reason is, again, the reason is it's because the protein is what the body reacts to. It's what the body makes, the lymphocytes in the body make antibodies against foreign proteins. And if you cook the protein, it becomes denatured. In other words, it is not as allergic. And the elimination diet is a pretty final step. And it's not one I think people should start out with unless they just say, look, I don't care what I have to do. I'm just going to go for the big gun. I'm going to do the elimination diet. And some people say that their lives are so miserable. And that's okay. There's nothing wrong with it. I mean, the elimination diet's a very healthy diet. You can stay on that your whole life. You can live on sweet potatoes and water alone. And I'm not joking. And this is one of the things that whoever is contesting the kind of dietary change that I recommend, they're contesting the idea that you can live on potatoes and water alone, or sweet potatoes and water alone. And by the way, we got a big bump as far as potatoes and water alone, and that's the movie The Martian. Have you seen The Martian yet?
Oh, yeah.
Lived on potatoes and water alone for a year. You can live on potatoes and water alone. You can live on sweet potatoes and water alone. And this is one of the confusing things. Of course, physicians in general know nothing about nutrition, nothing. So when they start giving you advice, just kind of look around the room and then walk out, because they know nothing about nutrition. I mean, you get a better lesson in nutrition by going to see Matt Damon's movie The Martian than you would by going to see most dietitians and most physicians. Go see The Martian. Learn how to eat.
That's a great movie. Dr. McDougall, I can hear myself from your computer, and it's echoing. Would you be able to lower the volume?
Sure.
So, because I know that people are hearing the echo, and maybe it is a little annoying. But you can still hear me, right? You can still hear me?
Yeah, I can hear you.
Okay, good. So now I can't hear myself. That's good. Okay. Very good. So I have a question here from someone that says, what is your opinion of total knee replacements for severe degenerative disease? Have you had success with any alternatives to joint replacement? Well,
if people have knee problems or hip problems, to the point where someone's recommending knee or hip replacement, they're pretty much end stage. You can be helped, of course, by eating a healthy diet and losing weight. If your knees and hips are carrying around let's say 70 pounds less of body fat, they're going to be a lot happier. But there are some modern medical miracles, and hip replacement and knee replacement are two of them. Now, I don't keep up with this, as far as the success rate, but I do see a lot of patients who have been through both. It used to be that knee replacements were kind of iffy, but I think these days they've got into a science where they're quite successful in most people. But hip replacements were just a modern miracle of my time, where people basically got their life back with hip replacements, or resurfacing is another procedure that I ask people to look into before they get their hip chopped off. There are treatments where they just resurface the hip, and you don't have to go through as much major surgery. And you have to realize when you go see a doctor for a hip surgery, that whatever the doctor does, whatever their expertise is, or however they were trained, that's what they're going to recommend to you. So you go see a doctor and the doctor says, no, I don't recommend hip resurfacing. I recommend total hip replacement. Well, it could be because that's all the doctor knows how to do. And that's how he or she was trained. So be careful when you go shopping for somebody to help fix your knee or hip, to see a couple of different doctors, to ask them, what their common procedure is, what they do most, because you can save yourself a lot of unnecessary visits if you want resurfacing, which is probably what I would choose, because for a whole bunch of reasons. When you go to a doctor who doesn't do resurfacing, they're going to tell you 16 reasons why you shouldn't have resurfacing, and instead you need total hip replacement. So do get lots of opinions out there, and make sure the operation really is right for you.
Right. All right. We have another question coming in here. Dr. McDougall, do you find that MS, arthritis, and other autoimmune disorders are genetic or caused by our Western diet? What did you find?
Well, they're not genetic. These diseases are inherited because mother and father teach child how to eat, and whether or not to smoke or drink alcohol, whether or not to exercise. You inherited these diseases by education. The amount of inheritance that occurs truly through genetic passage is extremely small, extremely small. And if you don't test your genes by straining them and stressing them with the Western diet, then you'll never find out whether you have that kind of weakness. Let me give you an analogy. Let's say you take two families, the Smiths and the Joneses, and you take 200 people in each family. And what you do is you ask them to smoke cigarettes, 40 cigarettes a day, let's say. And you follow them for 10 years, and you find that the Smiths get lung cancer and the Joneses get emphysema. So you say, obviously, this is an inherited disease. No, you just step one step back and you say, obviously, it's stupid to smoke. You'd never find out whether the Smiths or Joneses had a tendency to either one of these diseases. It's the same way with food. Your family may have a tendency to breast cancer, colon cancer, heart disease, or diabetes, or arthritis. You may have all those tendencies. But unless you stress your body and your genes with an aberrant diet, something that was never intended for people to eat, the Western diet, something that's sickening, 80, 90%, maybe 100% of the people in the Western culture. If you don't do that damaging thing, you'll never find out where your weaknesses and strengths are in terms of inheritance. So do not think of these as inherited diseases, even if they, quote, run in the families, because mom taught you how to cook.
Right. That's how it's passed on, I guess.
That's how it's passed on. And to believe otherwise traps you in a box that can't be fixed, because we have no way of fixing genes. More than 40 years, since 1968, I've been in medicine. So this promise of genes and how we're going to solve everything with genes was given to me my first day of medical school. It's just right around the corner. We're going to find the right genes and be able to tweak them this way and that way. I can't say it over the internet, but you know what I'm thinking. It ain't true. It's crazy. And if you're holding out for that kind of success to save your life, some scientist figuring out a way to go in and manipulate your genes, you're wasting your time. Mm-hmm. It's the food. It's the food. It's the food. Fix the food. You'll fix the problems.
Right, like your website. Yes, it's the food.
Yeah, I think the website's called "It's the Food." Hey dummy, it's the food.
So, Dr. McDougall, something was interesting at the beginning that caught my attention. That you said that some of the damage that is done with some people can't be reversed really with diet. So, in that case, do you prescribe sometimes prescription drugs to alleviate the pain or anything like that?
Oh, I do. My pavorite drug is not prescription; it's aspirin. It's my favorite pain-relieving medication.
Aspirin.
Yeah, it's just so easy and cheap and time-honored. When I first started taking care of rheumatoid arthritis patients, we didn't have all these fancy drugs, these biologics, and we didn't have methotrexate to use for inflammatory arthritis. I used to give aspirin till the patient's ears rang. I had patients taking 16 aspirin a day, and it was quite effective, and it's still quite effective. You may not have to go to that point, but I find aspirin the safest, most time-honored, and most effective in terms of pain resolution of any of the drugs that I run into, even the narcotics. Aspirin is a real pain reliever, and almost, there are side effects, but most people tolerate aspirin really, really well. So that's the drug I use. And then, of course, there are people that do get benefits from the biologic agents and the methotrexates, but you're talking about a big gamble here in terms of your immune system, your cancer risk, your risk of infection, your risk of going bankrupt if you had to pay for it. Try the simple stuff first. Mm-hmm. And the idea that these are disease-modifying drugs is a stretch of the imagination. It's just the patients are told by the doctors, these drugs, you must take them because they'll modify the course of the disease. Hardly at all, folks, hardly at all. It's just one of the sales pitches and a very dangerous and expensive way to hope that something's going to happen that is far less in terms of benefit than you're being told.
What do you recommend for someone who cannot take aspirin or ibuprofen? Maybe Tylenol. Mm-hmm. I don't, and some people have to go. Some people do use methotrexate with success. So I'm not saying that this should be completely out of the armamentarium. I think that these things should be considered, but you should start with the least toxic, least expensive first, and then move up. Right. If a good diet, or you can't follow the diet, or aspirin isn't enough, and methotrexate makes a difference,
Sometimes the risk is, many times the risk is worth the benefits. But it just should be tested. In other words, if you're going to go on, say, methotrexate or one of these biologic agents, you should be very certain that the advantages are there for you, because the risks are so great. And then say you're getting better. Say you have an inflammatory arthritis like rheumatoid arthritis or psoriatic arthritis or lupus. Let's say you're getting better. You could tell you're tremendously better. Then you have to get off the drugs. And you go in to see the doctor. You tell the doctor, look, look at my joints. We're just doing fine.
Mm-hmm.
I want to get off the medication. And the doctor says, no, you can't do that. These are disease-modifying drugs, and what happened to you is just temporary. And you get all kinds of, I'm not going to say the word again, but you get all kinds of biases. Let's say it starts, yeah, okay. You get all kinds of biases from the doctor, and the doctor's got an ego that has to be satisfied. Got to pay the bills, and all kinds of things that are not necessarily in your interest.
Mm-hmm.
So what you do is go find another doctor. I find when people come to my clinic, my 10-day clinic, I still see all the patients myself, along with Dr. Anthony Lim, and actually we have 7 physicians that help us when we get real busy. But they leave. Say they often come in on 20 medications, and they go home on none, and they go back to see their doctor, and the doctor is offended. How dare you stop the medications that I gave you? But doctor, my diabetes is gone. My high blood pressure is gone. Well, I don't care. I put you on these medications. And, you get that kind of attitude from the doctor. And it's prevalent in the medical business. It's not like I'm talking about something that's rare. These doctors get the attitude that they're next to God. And they're not going to be challenged. And even though, one of the reasons they don't want to be challenged is that they know they're wrong. And they don't want to see that the emperor has no clothes.
Right.
And so they get angry at the patient. Well, my attitude is, you get any of that kind of stuff from your doctor, they say, adios, let's clear my bill and go find somebody else. You don't need you don't need to waste your time with somebody with that kind of attitude. You're the customer. Get rid of that doctor and go find somebody that will help you in a way that that you think is reasonable. And that's not to carry around the biggest bag of drugs in town. You want off these drugs.
Right. Well, Dr. McDougall, someone is asking here, please throw some light on GMO foods and if they are safe for arthritis.
I hate to throw any light on GMO foods because half the people on the webinar, if I do. There's a newsletter on my website. It's called GMOs, Dangerous Distraction. GMOs are, Frankenstein foods. There's protests around the world of GMOs. Fine, stop them from making GMO foods. I don't really care. It doesn't sound like the right thing to do with our foods to do this kind of genetic manipulation. That's fine. But the practical problem for me as a physician and somebody concerned about planet Earth and the fact that it's being destroyed is that to focus on GMO foods is a deadly distraction. I have never seen a case of GMO disease. I've never seen a human being who's ever had a disease caused by eating GMO foods, ever. And maybe 5 years there will be, maybe 10, maybe 20. I understand your concern. But I see every day, 9 out of 10 patients are suffering from food poisoning from eating animals and vegetable oils. So if you're focusing your attention on GMO foods, and not focusing on the real problem. I mean, what you can see right around you. Just look around you. Look who's sitting next to you. Look who's working in your office. These people are dying of eating animal foods and oils, and that's where their focus of attention should be. That's why I call it a dangerous distraction. Same thing with all this gluten and gluten stuff. 30 to 40% of the products people are buying are focused on gluten, but they don't have gluten problems. They're sick from eating the American diet. And they're not focusing their attention on the real problem in terms of their disease. But even more important to me is the fact that this planet is dying. I'm up at the North Star in Tahoe, and we have snow. And everybody's just totally excited because we have snow. And it's such a rare thing to have snow up in Tahoe. And you know why, folks? It's called global warming. And at least half of the greenhouse gases are produced by eating livestock. So, get your attention in a place that'll make a difference for you and planet Earth. That's what I think about GMO. It'd be fine if they got rid of them, but I'm not going to spend a minute of my time protesting GMOs or working against GMOs, not until we stop eating the planet to death, right, and making not at least 9 out of 10 people sick in our society from eating the livestock. You shouldn't have gotten me on that, Gustavo, because I just made a whole lot of enemies. But get real, folks.
Well, yeah,
get
it's
real.
not
You got a whole life and a whole planet to save.
Right. Yeah. No, this is absolutely right. Cynthia here says, please explain the process for a person like myself diagnosed with RA. Should I start with the elimination diet, then revert to the ongoing plan detailed in the 10-day meal plan online? I have already been following a vegan diet for a few weeks before finding Dr. McDougall, so I've since eliminated oils. Okay, I read the whole thing.
Well, that's where I ask people to start. I ask them to start with the basic diet, starch-based with fruits and vegetables, no added oils. And as I mentioned, I started them without wheat products and without soy products. Start there. You're likely going to get your problem solved just by doing that. To start everybody off on an elimination diet, that's a big deal. If you want to, as I say, it's perfectly safe. The Martian lived on potatoes and water alone for a year. I mean, it's perfectly safe if that's where you want to go. And it may be not just because you want to get well as fast as you possibly can, but that may be all you're willing and able to cook is sweet potatoes or potatoes. So that's fine. Eat sweet potatoes and potatoes. Your chances of doing well with that kind of simple diet may be best for you. But few people have to be that extreme. Few. And I can think of maybe, no, I don't want to give you a number. I'll just tell you, only a few people. Most people can eat the basic McDougall diet. But then again, I have to say that Mary and I, and most of the people that I know and keep close contact with, we really eat a simple diet. Our diet is beans and rice and kale, or sweet potatoes and broccoli. That's what Mary and I eat. And so we pretty much eat a, close to an elimination diet just because it's simple and we love the food that we eat. And, you don't no need to make a big deal out of the diet. You need to say it over and over again.
Well, the taste buds, they do get reprogrammed. I have to say that in the last 3 years, I am now, what you're saying, I eat a very simple diet and enjoy the taste of simple foods.
Right, yeah, like that pea soup.
Yeah, that is one of the best.
Or Mary makes, a white bean stew, and she makes some black bean soups and
soups and stews are great.
Or rice with it, and maybe a little sriracha sauce, and that's all we eat. And I can tell you, there's nothing else I would want to eat. What about micronutrients? It sounds like starches have all the nutrients that you need, particularly the underground storage organs like potatoes and sweet potatoes. No problem at all. You can live on those and water alone. If you eat the above ground storage organs, which are seeds, they being legumes and grains, then you have to add a source of vitamin A or C, A and C. And that would be, say, you'd have to have a slice of orange a day or a flowerette of broccoli a day to add A and C to grains and legumes. But otherwise, you can eat that simple of a diet. So fermented foods, I would assume they would be okay on the basic diet with you, fermented foods. So that would be okay. Give it a try. Fermented foods are often salty, so you want to think about that. Maybe some of you need to be on lower salt diets. Is there a long-term healing on the starch-based diet? The benefits start usually in about 4 to 7 days, but they continue. The benefits continue, and it may take up to 4 months to get full healing. If you think about it, if you break a bone, say you get in a car accident or you break a bone, it takes about about 3 weeks before the bone is sufficiently healing so that you can notice a difference. And then it takes about 6 weeks where you maybe can get around a little bit on that broken leg or use that. It takes about 3 months for the healing to be complete enough so that you can fully function. You can compare healing with other diseases to, say, a fracture or a serious cut on how long it takes to heal. It doesn't take the body long to heal, but I'd say by 4 months you're going to get most of the healing. Salsa for potatoes, that'd be great. You know, if you're on the basic diet, there are all kinds of tomato salsas you can buy in the store. You just make sure they're oil-free, and you know that would be a good way to flavor your potatoes. If I had to live on one food alone, it would be mashed potatoes and some kind of flavoring. It would be great. Mashed potatoes would probably be sufficient, but I would put some kind of gravy on, or maybe a barbecue sauce or salsa, and I do just fine. Actually, one of my favorite foods when I was a kid, my favorite foods were mashed potatoes, peas, and corn. And when my mother used to make a gravy, of course, it was made out of beef, which we don't do on our program. Instead we eat a gravy made out of, well, you can see the website. Maybe I'll show you how to do that. Corn can be raw cooked, no problem at all. I don't see any reason you can't eat it either way, but it's more digestible. Everything's more digestible if you cook it.